Welcome to CaregiversTrainingVideos.com. Hi, my name is Jose Silva, and I'm your host for today's episode. CaregiversTrainingVideos.com specializes in giving family caregivers their learning tools necessary to succeed in a residential environment. The learning objective during today's episode is how to use a gait belt. Home Health Care Training Corporation used its best efforts in researching and preparing for this topic. We encourage the viewer to expand their knowledge on this subject for more accuracy and completeness. The demonstration you are about to view is for informational purposes only and not intended as medical advice. Please obtain approval from the resident physician prior to using a gait belt. The resident may have had recent abdominal or back surgery or other medical conditions that may prevent the use of a gait belt. Please read and understand the manufacturer's guidelines prior to operating this type of device. The resident should use appropriate clothing and non-slip footwear. The caregiver should also be in good physical condition prior to lifting and transferring anyone. Furthermore, a gait belt should never be used as a restraint. Home Health Care Training Corporation does not assume any liability or responsibility for damage or injury to person or property from any use of information or instructions contained in this video and website. The term gait is defined as walking or running in a forward progression. Patients with neurological disorders, such as Parkinson's, stroke victims, or people with limited capacity in their lower extremities that affects the timing of their muscle movements, may move slow and have imbalanced gait. To prevent falls and to assist with transfer, many caregivers use a gait belt. A gait belt is a safety device used to transfer an individual from one position or location to another. For example, transferring from a bed to a wheelchair or a bathroom. Many caregivers utilize this tool to eliminate injury to the resident and to themselves. Gait belts are purchased by buckle type, size, and fabric. Caregivers should consider the various buckles on the market. There are metal, plastic, and Velcro buckles at each end of the belt. Gait belt width size ranges are 1.5 inches to 6 inches and 48 inches to 60 inches in length. The belts are available in nylon, leather, weaved, cotton, and other fabric mixtures. Gait belts may have side grip handles for extra leverage and security. We just reviewed the definition and component parts of a gait belt. Now I will introduce how caregivers may properly use a gait belt on a resident. First, brief the resident. Always inform him or her of what is a gait belt. Also, give a step-by-step definition on how, where, and when the gait belt will be used. This information will reduce anxiety and feeling more at ease with the transfer process. Secondly, always use precaution. Caregivers at minimum should use protective gloves before any lifting or transferring occurs. Additionally, ensure that gait belt is worn over the resident's clothing. More than one caregiver may be needed to assist a resident with lifting or transferring. Our demonstration will be administered by one caregiver. While lifting a resident, use good biomechanics. Maintain a straight back posture and bend the knees as necessary. Keep the resident close to you during the transfer. Do not turn your body while lifting or moving the resident. Also, lift or transfer to the resident's strongest side. Let's apply what we just learned. Fasten the belt around the resident's waistline. Ensure the buckle is secure and placed in front of the body. It is customary to leave room for your fingers in between the belt and the patient. This will allow you to hold on to the belt during lifting and transferring. Again, with good body mechanics, assist the resident to stand or sitting position. Also, gait belts can be used as a precaution while the resident is walking. The caregiver should hold on to the belt on the resident's weakest side to prevent falls. Remember, more you perform gait belt lifting and transferring, the more proficient you will become. That's it for this episode on CaregiversTraining.com. I would appreciate it if you visit our sponsor's website for exciting information and offers. Please email us with your comments at the link below. Thank you for visiting our website. Again, I'm Jose Silva, and have a great day.